Welcome to the So Tell Me podcast, where I talk with fascinating professionals about the work that they do. I am Dr. Melissa Deuter, and today I'm talking with Thomas and Matthew Dietz, brothers and nurse practitioners. This podcast is sponsored by Sigma Mental Health Urgent Care, located in San Antonio and Austin, Texas. Okay, so welcome, Tom and Matt, the brothers Dietz. I wanted to have y'all on together because you're both nurse practitioners, and because I'm very interested in the fact that you went through school together. We've talked a little bit about that in the past, but I've never been able to sit down and ask you about it. And so I'd like to know more about that, and I'd like to know how you both ended up going into this same field. So I don't know, whoever wants to start.
Go for it, Matt.
All right. Yeah. Now, so with the schooling piece, I always wanted to go back, but couldn't find the right catalyst or jumping point to really do that with going back for my master's and just doing more, right? Because that was the huge motivation there, was working inpatient and working residential with teens and just seeing that, wow, quality of care really needs to get better.
And
So,
can I interrupt in that? So you were working, you had a 4-year RN, a bachelor's in nursing, and you were working as a nurse and saying maybe I could do more if I did something, if I did some more education.
yeah,
Okay.
exactly. Because I had started in Ohio and inpatient, where it was acute care with adolescents and children. And then in Texas, ended up being adolescents, but residential. So they'd be there, anywhere 2 weeks to 6 months on average.
And this was psychiatry. It was all psychiatry. Mm-hmm.
Yeah. And then Tom told me how, he was wanting to kind of switch gears with what he was doing, because originally he wasn't psych and wanted to go and be an NP. And I just need that kind of a little bit of a fire, like a match, essentially. And so when he told me that, I was like, okay, I can't keep putting this off. Right. Especially as I started seeing more and more inequalities or just inadequate care or, insurance issues where someone's being forced out after a week because of insurance when they need to be there, much longer in inpatient because they're going back to an unstable home. There are factors like that. So,
Well, why did you feel like getting your master's and being a nurse practitioner was going to help with that?
I knew there was limitations to what I could do as a charge nurse. I think the system too, as in management and that kind of just reinforced that, a lot of devaluing positions. And it was I know if I can go over that and, I'm the one who's prescribing or doing certain therapy modalities or just listening, right? Even that, I think that's such a huge thing in psychiatry that to this day is not utilized by nearly enough people, is truly listening to someone's story, as opposed to just, I'm coming here with this, and then, oh, okay, well, depression, here's that, versus, well, let's actually talk about your life and what has really led to this. So that alone, I just felt that if I could hone those skills more and really learn the knowledge of, pharmacokinetics and everything else, and really just strengthen that base, that can make a bigger difference. And so that's why it was almost like I have to go back at that point.
Okay. Okay. So Tom, what about you? I mean, what were you doing before you talked to your brother and said, I think I want to be a nurse practitioner?
Well, I did a lot of things. So initially, I was a paramedic, back in the early 2000s. And I was doing that, and then I kind of looked around at some of the middle-aged guys who were doing it, and I just thought, I don't want to end up like a lot of those people. They get very a lot of injuries and stuff from picking up heavy people and things like that. And the pay is not very good. And even at a young age, I knew I wanted to have a family someday, and so I wanted to be able to support them. But I was just kind of floating around and still doing it for a couple of years. And then one of the guys that I worked with had just come back from Iraq, and he was telling me about the Army medics, and I thought that sounded pretty cool. And at the time, I wasn't really I was not good at school. That didn't come from me until later on. I'd never had the ability to just be able to sit down and then read something. It was like almost painful to do that. But that kind of changed once I joined the Army, and I think I just kind of matured and then grew out of that during that time. So I did my 6 years in the Army, and then when I got out, I was like, okay, I'm going to go to college. Like I felt like I was capable now of going to college and doing that. And so actually originally I was going to do what my wife does and become a physical therapist. And they had a program down at Kansas State University, which we were living in Kansas at the time, where you could have an associate's and then go into a DPT program to get your doctoral degree as a physical therapist. And then that semester that I was going to apply, they changed it, and you needed a bachelor's degree to get in. So I was like, oh shoot, what am I going to do? And I can't remember if Johnny was already an RN at that time. Do you know, Matt? He may have been.
Yeah,
Our youngest
other
brother
girl.
was.
This,
right.
Yeah.
He was the first one to become a nurse. Yeah.
okay.
Yeah. Yeah, he was the first one to become a nurse. And then so I thought, like, well, RN would be a good career, I felt like. So I picked that, and then San Antonio College actually had a military medic to RN program, and it was just a 1 year program. So it was all accelerated kind of stuff. And so I was going through that. And then one of the other girls that was in the program was like, hey, did you see the other day UT Health was up here advertising their associate's degree to master's degree for nurse practitioners? And I was like, well, are you going to do it? And she's like, yeah. And then so I just thought, well, she's going to do it. I have to do it. so,
Okay.
so I applied to the program as well. And then I ended up getting in. It was just contingent on passing my NCLEX. And so I passed the NCLEX. And then I started.
Did you go in with a plan to work in psychiatry, or did you not know?
I just had to come to that decision when I was submitting my packet, right? So UT Health has the option of, like, I think OB, family nurse practitioner, gerontology, acute care, and psychiatry. And I was just looking all over those different kinds of things. And I was like, okay, which do I want to do? Matt was already a psych nurse at the time. And so a lot of the things he told me I liked. And I thought, okay, what could I see myself doing and being happy with? And I thought, yeah, psychiatry would be good. A big part of that too is after being in the military, I was kind of worn out on trauma related kind of stuff. So I knew that I didn't want to do anything like an FNP, working in an emergency room or something like that. I was just tired of that kind of stuff. I wanted to do something different, and psychiatry offered that avenue, that ability to sit and talk with people, which I really like doing. So then I applied to that MP track, and then from there, all the psychiatry experience I was getting was just in school, and then from the clinicals. I had nothing prior to that. And then when I was going to school, I just picked jobs as an RN that were flexible jobs so that I could go to school and then also have a job that wouldn't fire me when I told them, hey, I got a hard class here, I'm not going to work for the next 2 months. And they were okay with that. So I did pediatric home health nursing, and then I also did drug research. I worked at a drug research facility as well as a nurse. And then once I got into my clinicals, that's when I really started getting into the psychiatry stuff. So for me, it was like everything came later to me than it did for Matt in that sense, because he noticed like a lot of issues in psychiatry when he was a psych nurse. I didn't notice it until I was already a prescriber, because I didn't have any previous experience with that stuff. But then I started seeing things, and I was like, oh, like, that's not like they totally missed this, or how did somebody not ask you that question type of thing.
Well, at what point did your paths converge?
Yeah, I was already in MP school, I think, for a year. So I was doing the associate's to master's part-time. And so that was a 4-year program. But Matt already had a bachelor's. So if he went full-time, it would be just a 2-year program for him. So I was almost at the 2-year mark in the program. And then I just kept harassing him, like, you have to come down here. You have to come down here. Like, if you can jump in on this class, we will graduate together. And I don't know, it was like a couple of months probably of me like harassing you. And then finally he did it, and he applied, and he moved out here, and it was awesome going to school together because we had a lot of classes together, which was very cool.
Yeah, so what was that decision like? Your brothers harassing you to move from Ohio to Texas, which is a big change, to come and go to the health professional school he's attending to apply and get in. Like, that's a big jump. He's got a lot of influence over you.
Yeah, I knew if I was going to do something like that, and I mean, just that opportunity itself, once it became like a reality that if I do get in at this point, like we could actually go to school together, like that alone was enough, honestly. And it was a point in my life too where I kind of wanted to leave anyways.
It just seemed like it would be fun to work together, or
yeah, and just go through it because we never had school together ever. We went to, like, I mean, with him being in the military, and like I was at Cleveland State for my bachelor's in biology, and then because originally the plan was to go to med school, and I took the MCAT, withdrew my applications and everything, and then went back for a second bachelor's in nursing. But then when that came up, it was just, yeah, I mean, I was sick of the cold. I wanted to explore, and see. And anytime I visited him in Texas, I absolutely loved it. And it was just like, you know what? Why not? So I transferred hospitals the same. It's all like one big system. And so it was very easy, and I have to like get a new job per se. It was just transferring over to Laurel Ridge in Texas.
oh, and so it was a partnered organization with where you worked up there. Okay. Oh, that's interesting. And then you came here, you worked, you went to school, and then y'all were in school together. And then, like, one of the things I've heard one or both of you talk about is going through clinicals together and working together in the clinical setting in school. And so I want to hear about that.
Oh my God, yeah, that was that was so much fun. Yeah, gosh, yeah, we would meet up at Gold's Gym in the morning, get our workout in, go back to Matt's apartment, and we'd make this like huge breakfast, and then we would go and do our clinicals together. But yeah, it was cool. Matt was very helpful to me because he had a lot more psych knowledge and experience. So he was always there to answer questions and stuff like that about certain drugs and things that I was unfamiliar with. So that was good.
Because he'd been working on the inpatient unit. He'd been seeing all this from the RN.
Right. And like he had actually worked psych. I had never worked psych. I just knew what I learned in the books about psych drugs, but that kind of stuff, it doesn't really solidify in the brain unless you've actually held it in your hand or prescribed it or have done whatever with it. Like remembering that olanzapine is Zyprexa was like a really hard thing for me to do at the time.
Mm-hmm. I imagine, because the way the two of you are, that when you were working together, there was a lot of laughter. And when I think about you working in psychiatry, I don't know if that sounds appropriate. And so like, it seems like you'll have a very playful way of interacting. And so did you ever get like in trouble for being too playful, having too much fun?
No, we never got in trouble. Like we know how to be professional when the time comes, but definitely when the opportunity to be funny happens, like we're gonna do it. Yeah,
And then
for
dial
sure.
it down.
Yeah. We just kind of turn it off and turn it on.
Exactly. Okay. And so how would you both describe what you're doing now or like next? Because Matt's in a master or in a doctorate program now. And so, I mean, where are you going with that, or do you know?
So I wanted to go back, largely in part, again, it was just the mentality of like, I want to reach the peak of what I can do in this profession or have a larger effect. Whether it's getting a message out, like that we need to improve overall care, especially with where I work now, a federally qualified health center. I mean, I just come across so many things where I'm like, oh my gosh, how is this person on these things? Like the fact that someone has had this going for years, right? Whether it's like Xanax 2 milligrams, QID every day. Oh, and then also Adderall 120 I mean, that's a real like case, like a real
Well, what
person.
do you think creates that? Like, what do you think is the underlying reason that somebody is on, so they're on two addictive medicines that kind of counteract each other in a way. And you're looking at that as a clinician saying, like, I don't think this is appropriate. How do you think it becomes that way in the first place?
I think in part it's definitely like, more of an old school way of thinking, like people just not being up to date on current practices, and they may have done something, 30 years ago, and they never in any way really kept up like truly on, CMEs or anything, and just kind of, all right, well, this seems to be working, right? And they kind of go out their business, and then these kind of cases are created. I also think it's kind of like I touched upon earlier with the whole thing of not truly like listening, because it turns out there was a whole substance abuse issue that wasn't even clinically known, that had never been explored. It was more so I lived in this state for a while. I was having attention issues and anxiety, and so this person prescribed me this stuff.
So when
So,
you go through the doctorate, I mean, how do you see yourself, or you may not be sure, but influencing change? Like, what can you do with that education that's going to help you?
yeah, I want to, well, definitely, really want to teach at university, and the DNP is required for that. Also, had more involvement in policy because before this program, I've very much been more so about like just that direct patient care experience and improving my knowledge and everything there, and not really knowing as much as I should about policy and what's really going on federally or at the state level. So definitely getting more involved in that as well, especially with where I am now and seeing like the realities of those things. It's like, okay, like this really is bad, depending on like medical comorbidities and everything. And just, I think just quality of care just needs to overall improve. I think there's certain, even with myself going to certain appointments and certain specialists where I'm like, there's not even an exam happening. And
Yeah.
you see 5 times, and you have no idea. I could have a growth coming off my stomach and you wouldn't know because you never even palpated, you never auscultated, you never anything. Like you just go, where's it hurt at? And okay, well, here's this med. And then and you're done seeing me. Like, so that's another piece. Like, and I don't know where to even start with that, in terms of or falsification of documentation, because of course people just read, you could read the notes now, of course, and it's oh
Well,
yeah,
I mean, I think that raises a really important policy issue, which is that, I mean, the policy issues really drive a focus on documentation over a focus on delivery of care, right? So if I work in a hospital and I am accountable for all these points being in my note, I might go out and spend more time sitting at the computer desk trying to get all those points in my note than in the room interacting with the patient, because that's how you get paid, that's how you get regulated, that's what's overseen. And so it is a real problem that's the focus. And then it pulls you away from where the focus should be, which is how do I take the best care of this person in front of me?
yeah, definitely. So that's where I want to start and just look more into really, right? And see, okay, how I would like, because now that I'm learning more about policy too, and just how convoluted a lot of it is, and regulations for these regulations and all these revisions. And
Yeah.
it's just, oh my gosh, like, I can see why some people are like, oh, tear it down and start from scratch, because it just gets, yeah, like very complicated.
And Tom, do you have any interest in things like policy?
Only pertaining to things that I'm doing directly, I guess.
Oh,
So with starting my own private practice, obviously, I'm having to develop policies personally for my clinic, but Like on a more bigger scale, like what he's talking about, that's never really anything I looked into. I'm sure it's very important because obviously it governs nurse practitioners all throughout the United States. Um, Maybe I should probably get involved in Texas policy, especially because Texas is one of the most restrictive states on nurse practitioners. There's a lot of things we're not allowed to do that other states allow their nurse practitioners to do. So,
So,
yeah.
so I wanna talk to y'all about this too, because like there is this kind of tension between physicians and nurse practitioners that I think is I understand and don't understand. It's unfortunate in a lot of ways, and I'd like to hear what y'all think about that. And there's a lot of concern about folks from physicians, right? About nurse practitioners coming in and potentially trying to do work that they don't have the skill for. And I think honestly, the two of you went to a very excellent master's program. But part of my concern about nurse practitioner work is not everybody went to a very excellent master's program. There's such a wide range of educational options that are really, once you're out there, that may not be obvious what your background is. I think you're also both very clinically responsible people. I don't think you want to do anything that you don't know how to do. I think you want to ask for help, both of you. If you don't know, you're both reading, you're going to conferences, and that, like Matt said before, that somebody's 30 years out of date in their, the guidelines they're following. And so I on the physician side, that's the understandable part, I think, of the concern. But y'all tell me, what do you think about independent practice? What do you think about what nurse practitioners are doing, and should they be doing, and could they be doing?
Yeah. I personally, I feel like directly out of school that an NP should not be able to just go into independent practice out of school. Yeah,
Why?
because you just why? Because number one, the amount of hours that we do for our clinical experience is not that much. When we went through, it was 600. The MP student that I'm precepting right now, I think it's been bumped up to 900 or something like that. But that's just not a lot of time. Like my
Yeah.
first preceptorship was with a nurse practitioner, but she never let me interview anybody because she was crunched for time. And she was an awesome person. I'm not trying to knock her at all. She helped me get my first job, but she had to be out of the clinic by like 3, and so the schedule would always run kind of tight. And of course, if I, as a student, was interviewing somebody, it would take longer because I don't really know what I'm doing. So I always just sat and watched, and I never did any kind of interviews. And then
So you can observe, and 600 hours, I mean, that could be 60 10-hour days. It really isn't, it isn't that much time. But
right.
under the model, the way it was developed, to come out and deliver care under kind of the guideline of somebody with more experience, who's a physician, who's given you hopefully a direct algorithm, and you're in a narrower field, and you're doing what Dr. So-and-so prescriptively asks you to do, right? It makes sense in that context. When you get into the independent practice, I think a lot of the guidelines do require a lot of experience, right? That you have to have reams of experience before you can be considered for that, is my understanding. But we don't do it here, so I'm not well versed. Is there?
Yeah, and I think that there's
in Ohio. No.
Yeah, Ohio, it's less restricted than Texas, but there's still no independent practice.
Okay.
I can do like Schedule 2s and that with. Yeah.
Okay.
Yeah.
I think there's 26 states that have independent practice, and I've looked at the guidelines for some of those states, and the way that they have the guidelines is like exactly the way I would think of doing it. Is where in the beginning the nurse practitioner does have a supervising physician, and then they have to have so many years in, I think it's 5 years in as a nurse practitioner, and then proven, so many hours of actual clinical experience, so just showing like, hey, look, I worked 1,500 hours at this job this year or whatever. And they have to have all that time in before they can go independent practice and not need a supervising physician anymore. And I think that's like, I would love to see something like that in Texas. That makes sense to me because my 5 years of experience now is, you know, like close to what a resident there is doing for their experience as a psychiatrist. And then once they're done with that, they could go independent practice if they wanted to. Now, granted, they have the background of medical school, which is they're learning a lot more about the human body and the brain than we are in nurse practitioner school. But from a clinical standpoint, it seems like medical school itself does not teach all that much psychiatry. And I'm just basing that on all the medical students we have come through. I feel like, well, when I went through the Psych MP program, I was definitely more prepared for psychiatry than just a general medical student is.
Yeah,
Um,
I think that's probably
but
true.
then when you,
It's more
yeah,
focused, and yeah, I think that's probably true.
yeah,
And this is a really controversial topic. People get mad. People get mad about this on both sides, right? Like I've worked with both of you. I know you. I like you. I'm not in a position like some of my colleagues who are upset because like there are people who are, you know, fellowship trained, board certified child and adolescent psychiatrists who work in hospitals who get replaced by somebody who is a nurse practitioner who has a questionable level of experience, and they're worried about safety and whether or not that person's really ready to be in that role and whether that's appropriate. And I think that's a really legitimate concern, you know?
No, I
yeah,
totally,
absolutely, yeah, absolutely.
yeah. I mean, something I've like seen in, you know, states like Colorado and that and other ones. Now, I'm not even gonna pretend like I know, right, the amount of hours needed, or because I don't, or what ones don't require hours at all of supervision first, or, you know, collaborative care. Um, but something I think is very just touching upon like what's safe and what's really best practice. I do not like seeing like someone graduates from NP school, they find a physician who's gonna, you know, be in agreement with them, and then they're just have their own practice.
Yeah,
Where that in that physician, of course, right, is a, you know, a hospitalist or whatever, they're to have their own practice, like because there's no way that that physicians have the time to adequately supervise them, and there's no way that school program prepared them enough to have their own
right.
practice.
I totally agree with that. I totally agree with that. Like there are people, I think there's a nurse practitioner that I've known here in the community in San Antonio for years who's been in practice with the same psychiatrist for, you know, more than 20 years, probably more than 30 years, and is knowledgeable and skillful. And at this point, after 30 years, does basically the same job as the psychiatrist that she works with. And I think we have to acknowledge her level of skill and experience and, you know, the amount of CME that she not only attends, but, you know, invites other people, coordinates meetings, gets speakers to come in. There are a lot of really neat things that people do, but that's really different, right, than your NP student you're precepting with who has who's new at this and has such little experience. And I don't know what the solution is. I don't think fighting about it is ever the solution. I think, you know, one of the things that I also find really disconcerting is the way the agreements and where things stand now. And we're all over here making a lot of our own personal choices about how we're working, but some people are not. So you get hired onto a hospital, you're in a relationship where you're the nurse practitioner and or the physician, and you have this delegating relationship that you didn't select the person, you didn't interview them, you're not sure if you're comfortable with them, and then the physician is liable for the work for this person. They're just hired into a role, they have this delegating relationship, and now I work with Tom and Matt, and whatever you do, I'm legally responsible for, but I wouldn't have hired you if I'd been given the choice because I don't think that you have the right skill set for the job. I think that's terrible. That's just, that shouldn't be allowed.
Mhm. No, yeah, I can
Yeah,
completely.
yeah, I agree with that.
Yeah. Yeah. Any other thoughts on that, like where it's going?
I believe.
I would, oh, go ahead, Matt. I would say over time, I'd be willing to bet that more and more states are just going to open up the full practice. I mean, that has been the trend to begin with, and it seems like since the dawn of nurse practitioners, they just continue to gain more and more power over time. I can't think of any time where nurse practitioners lost ground, where they lost any kind of power that they have. And I think it just comes down to one thing: is the demand, right? The demand for healthcare. I mean, look how it is with psychiatry right now.
Yeah.
You know how hard it is for people to get into clinics. I put myself on ZocDoc a couple weeks ago, and I've already gotten like 15 patients from there. There's just like people are lining up to come and see you. They don't want to wait 3 months because that's what it is for people who accept insurance.
And sometimes they can't. Sometimes they're not stable enough to wait 3 months, you know?
Yeah.
And what do you say about that, man?
Yeah, I mean, I totally agree. And also with inpatient as well. Like bed shortages right now, at least here in Ohio, are absolutely awful. Where, I have to pink slip someone and it's like, oh, there's no beds within 50 miles for 4 days at least. It's just like, oh my gosh. Yeah. So that's just, I mean, it's not just that outpatient, it's definitely the inpatient realm as well, where it's just the shortage. And I agree about, I think there's going to be more states that the legislation's going to go more towards independent practice. I mean, it kind of has to, because even with psychiatrists, right? Like the amount of people that are doing residency is psychiatry and that. It's just
And it takes so long. I think we need physicians, we need residencies, we need those roles, but it takes so long to get people into them. And I guess if I could advocate for one thing, it would be for people to be accountable legally, accountable in a way that they're overseen, in the way that they maintain certification and are tested and are evaluated. Just, if you're going to take on that role, you should be accountable and overseen to make sure that you stay within the bounds of appropriate practice under any licensing. So, okay, I'm gonna switch gears. I have another question. What about y'all's lives as a family do you think contributed to the fact that you're both in the field of psychiatry? And you can be PC about that, but like, it's interesting, right? Like, it's not that you come from a long line of people who work in this profession. No.
yeah. Yeah, no,
Yeah.
yeah, because I mean now it's right, there's three of us. Like our little brother John's at the VA was a psych NP.
And this is 3 out of how many in your family?
5 kids total.
Yeah, so you have 3 people who are nurse practitioners who work in the field of psychiatry out of 5. I mean, that's statistically a lot of people. Okay, and so I want to know what is responsible for this.
I mean, for me personally, ever since I was a kid, I knew I wanted to be in medicine in one way or another, right? Like in healthcare, I absolutely loved it. That was fascinating learning about the body and everything. All right, I in undergrad we did like gross anatomy with human cadavers, and that just deepened that appreciation of how complex and like beautiful structurally not everything is. But definitely started in childhood, where, and even with psychiatry, was like as soon as we did that piece in nursing school, I knew the first day of that rotation, which was only 2 weeks, as compared to like 4 to 10 weeks with everything else. It was much shorter.
What do you think that was? Why was that appealing to you? Is it something about your personality, about your life experience? Did you have a friend who was hooked on drugs? Like what was that?
Yeah, I mean, for me, definitely personal life experience. Growing up, definitely at times a difficult childhood. Just our family dynamic. We had, mom was stay at home and taking care of kids. My dad was the sole provider, and his upbringing, and it just really firsthand taught me, like over the years, how much that does play into mental health, right? What someone else dealt with, and then with their trying to make better for you as you're growing up, but what they either project on you or, and so that was like a prime example of that was he didn't know how to deal with a lot of his stress in that. And, a lot of times, fortunately, that would come out on us.
Mm. So
So it
you
was
go in there and you sort of, it's going to answer a lot of questions. It makes a lot of things make sense. You can empathize with other people's experience, that kind of thing.
yep, exactly. Yeah.
Yeah, me
Which,
too.
yeah. And
Okay.
then, yeah, and I just think psychiatry, without a doubt to me anyways, is the number one specialty when it comes to like true like active listening, like that term we're always taught, right? But like that is the heart of so much of it. And having that empathy and really being able to relate in some way, even if you didn't experience anything close to that,
Right.
just that people go through and everything. And just not dismissing it because I think that just happens so often. But
And there are a lot of people who go into psychiatry fields and fields that are clinical and not hospital based, non-surgical fields for the lifestyle and the schedule. But this wasn't that for you, Matt.
mm-mm.
You're just drawn to it.
Yeah, I mean, I remember the first like day clinical we had was like independent living, but for geriatrics with like psych diagnoses, right? And just spending that day with this woman and she's, oh, can I read my journal to you? And me sitting there and yeah, and then singing while she's playing piano and this and and then she's crying at one point, just saying like, thank you for listening to what I have to say about things. Like people don't do that here, right? They kind of walk away or okay, yeah, later on. And so just thanks for doing and that was it. Like that's all it took. Like
Somebody just appreciating you, genuinely being interested in their story.
right.
Mhm.
Yeah. And just that whole exchange, like that therapeutic, right? Relationship just there for a couple hours, was just amazing to me. And just seeing the difference that can make in someone's life, even just those brief moments.
So is it the same for you, Tom, or is it different?
No, I mean, it just like before, I would say my love for psych wasn't realized until I was actually doing psychiatry, and I probably did pick it for reasons of the potential lifestyle and things like that that it did have to offer. And I've always, I just in general, I love people. Like I just like people are fascinating to me, and why people do things is fascinating to me. And throughout my life, my like younger life, I was always told like that I was an easy person to talk to, or people would say, I just want to tell you like personal things and stuff like that. They felt comfortable doing it. And so I think maybe I just kind of had like that natural ability to talk to somebody without coming across as like intimidating or judgmental or something like that. But really, I wanted to psych because Matt was doing psych and he said he liked it. And I figured, well, if Matt likes it, I'll probably like it too.
Yeah, and I want to say that really comes through in working with you, actually, that you're like, wow, look at that. Look at this. This is a unique kind of person. It really does come through because it's just very much like, wow, I saw
Yeah,
him.
yeah. Oh no, I get I get really excited about that kind of stuff. I just want to know, so especially like, bizarre type of behaviors and things like that. I just want to know what is it in this person's mind that led to them making that decision. Like you can't wrap your mind around it. And I love things that I can't wrap my mind around.
And trying to wrap your mind around them.
Yeah, yeah. The process of trying, right? Like how did one action lead to the next action?
Mm-hmm.
Yeah, it's a lot of fun.
No, yeah, it's I call it like the detective work of psychiatry
Yeah.
too. It's like the puzzle, right, that can't be figured out. And I want to figure this out to help this person. And then also to deepen my understanding of what exactly is occurring.
Mm-hmm.
Mhm.
Yeah, that's true. It's exactly how I see it too. It's like it's a puzzle. Somebody says something like, I'm feeling depressed. Okay, when did that start? It started 2 years ago. Okay, what was happening around that time? And then you just start building all these pieces together, and then in the end, you have like just a complete puzzle in front of you, and it's like, oh, well, it seems like you probably were depressed because you were going through the divorce 2 years ago, and you know, you just go through that, and people like they don't realize that kind of stuff when they're in the middle of living it. You know,
Right.
the things that are happening to them, they don't see how those events actually impacted their mood, and to them, their feelings are like a big mystery.
Yeah, the other thing I see from both of you, again, having worked with you, is that the other part of the puzzle is how you're going to help this person. There's like putting together the underlying like cause in your mind and understanding. But I think both of you are like, I'm going to find a way. I'm going to try this, and if this doesn't work, I'm going to try that. And if it's ineffective, I'm going to go ask somebody, and I'm going to regroup, and I'm going to try again. So there's like the challenge of understanding their problem, and then the challenge of helping that person somehow, some way, based on what you discover. So
Yeah.
yeah, like that's, y'all are both like that, I would say. Fascinated and determined, stubborn even, but like in a good way.
Yeah.
Stubbornly dedicated to helping. Okay, well, good. So I mean, I would ask both of you, if you had it to do over again, is this what you do? Would you do something different?
Oh
Would
yeah,
you change it?
no, I would do this 100%. When I first became a nurse practitioner and I was working around psychiatrists, like I felt kind of inadequate, and I thought, you know, maybe if I was a better student when I was younger, I could have gone that route. But now I see, man, doctors have a lot more stress put on them and a lot more demand and expectation. So I kind of like being in the middle a little bit, to be honest with you. It's easier, it's lower stress, but I still get to do the things I want to do, the prescribing and the diagnosing and the stuff that I love, without the additional sort of things that the physicians have to deal with.
Like what? And I know what you mean, but
Yeah, so for your example, like working in a hospital, right? You know, so I get hired at UT Health. I'm a nurse practitioner. I got my supervising physician. He had no choice, like you said, you know, and he had all the residents underneath him. He had several nurse practitioners underneath him, and he had to keep up on all of our, you know, monthly meetings and answer our questions all the time, all that kind of stuff. All I had to do was show up to work and see the patient. And that's what I love to do, and that's what I did. I didn't have to worry about other duties being put on me, because if there's a physician in the clinic, the duty is going to go to the physician because they're top dog in the clinic. So being at the top of the ladder is, a lot of times, it's not a good thing, because you're having to do a lot of things that you really didn't sign up for.
yeah.
No, I think I also would make the same decision. And again, kind of going the not just the policy side, but just touching upon what we're talking about right now too, with physicians, there's a lot, I don't know, like growing up and now I've always deeply respected physicians, right? So as I, go to different places or interact with different ones, like at hospital systems here, and start to see I almost like a swing of power from the business side, especially if it's like a business ran place heading it, management versus like physician led, just
Yeah.
those differences and things I just see that I don't necessarily agree with in terms of trying to take power away or clinical say away from the physician because certain numbers need to be met or certain, and I just like ethically, I just don't agree with it at all. Like for the physician, right? Because
Yeah.
it's, it goes against what we're all here for. We're supposed to be trying to improve care and deliver the
Right.
best.
Yeah, and I mean, I agree with that. Having healthcare run as a for-profit business is a real problem. I've been, and I've been a physician. I graduated medical school in 2000, and I've been here for this whole transition from a much more like service-led, like, medicine's a calling. We take care of the least. We have these programs to do that, and that's why we're here, to this transition into, insurance and all those middlemen and all those salaries and hospitals and now there are these groups that are consolidating small practices, buying them up and then we even have outpatient practice now is this big conglomerate for-profit business owned by these big healthcare conglomerates. It's really worrisome. It's part of the reason there's so many problems is that somebody's, not able to just do what they think is right. A whole lot of middlemen. So, yeah, well, I mean, this has been great. I hear you both saying you're in the right place and you love what you do. And it's interesting to me because Matt, you're in this doctorate program and it seems like Tom, he's just happily where you are. You're here, not really necessarily trying to go anywhere else. You're liking the clinical work and continuing to do more.
Yeah. Getting the DNP thing that's definitely something I want to do. I don't want to die without having a terminal degree for my career. But I entertained the idea of doing it sooner than later a lot more until Matt was in the program and I saw how much work he was doing. And I have a 9-year-old and a 6-year-old. So, a 9-year-old and a 7-year-old. But to me, like family is everything to me. Being able to spend time with them is the absolute most important thing for me. So I'm always trying to manipulate my environment to make something like that happen, right? I came from UT Health, which was much busier, much further drive and things like that. And then I came to your clinic and a lot more freedom, a lot more time I get to spend with my family, a lot more lax on things like, hey, I'm not feeling all that great. Can I work from home today? That kind of stuff. It makes such a huge difference. And it's all because it benefits my family. So I think I would be miserable doing the amount of work that Matt is having to do in that DNP program, plus working and then not being able to spend time with my kids. I mean, even because now I'm working, doing Friday, Saturday, Sunday, Monday, 12 hours every day with this, the private practice that I'm doing. And even yesterday, I got pretty busy. I had quite a few NPVs yesterday. And my daughter came in my room and she's kind of teary-eyed at the end of the night. And she said, I didn't get to spend any time with you, So I kind of had to explain to her, like when you're starting something up, like there's sacrifice involved, but I promise you, like, this is not how it's gonna be forever, sort of thing. But yeah, everything I do is to try to increase the amount of time that I'm spending with them. But when they're older and they don't care about me anymore and they think I'm dorky or whatever, then definitely I would like to go back and then get the DNP. But right now they want to be with me, so I'm going to cherish every moment of that.
That's very nice. That's very lovely. And relatable, all of that. Well, cool. So, okay, the last thing I want to say, is there any information you want to share about how anybody would find your website, locate you? I mean, obviously, so Matt used to work here at Sigma Mental Health Urgent Care. We have a website. I'll share that out with the video because technically Sigma is our sponsor for this. And but is there any information you want to share about how to contact you or?
Yeah. So I'm on Headway. So you could just search for my name, Thomas Dietz, on Headway. And I take several different insurances, like the most popular ones in Texas right now. And then I also do private pay as well if you don't have insurance.
Yeah, for me, just LinkedIn, really.
And because right now you're still the big work that you're doing is this doctorate in as a nurse practitioner. And so you're not soliciting business for clinical because you're working for an entity and doing this graduate school program.
Right. Yeah, I'm doing the DNP program full time and then working full time too, which that's an art, right? Like, I know it seems like very scary for when you do go back, Tom, but the full time component of it is definitely the part of stress comes in.
And Matt, you've been in a movie or two. Do you want to share anything about where people can see that?
Yes. I was in Eyes of a Roman a couple of years back. That's on Amazon Prime and a lot of other streaming services too, actually. But let's say the main one is
I
Prime.
had the honor of attending your premiere.
Yeah.
Thank you for inviting us.
I love that. It meant a lot to me. You were there. Oh, and most recently, I was in a Sherlock Holmes film that's going to be coming out, and most likely like holiday season of 2024.
So
So
have you already shot the film and they're now in post-production?
yeah, they just started post-production about a month ago. Month or two.
Wow,
Yeah.
you're a famous actor.
And so I will be back for, so I'll be letting you know about the premiere for that too.
What fun. That's amazing. Okay, well, I know you'll have to get to other things and this has been a long conversation, but this is awesome. Thank you both for doing this and just sharing so much. And this has been great. This has been a lot of fun.
Yeah,
Yeah,
thank you.
thank you. It was a lot of fun.
All right.